I also wanted to say that in the last 24 hours we've had over 18,500 tests, and so thank you to everybody for coming forward. Several hundred of those have been in the Albury community. We do want people to come forward and get tested in our border communities in particular. Dr. Chant has briefed us appropriately that what we're in the process of doing is what we call mopping up potential seeding. So we know that for some time, obviously, community transmission has been high in Melbourne, and so what we are very alert to, especially given the number of people on those border communities coming back and forth, that we want to make sure that we're flushing out any potential seeding that occurred prior to that spike in cases becoming evident, to ensure that there's no trace of that level of community transmission, particularly in those border communities. Can I please stress again what I said yesterday? Please, if you are living in those border communities, don't move out of your border communities at this time unless you absolutely have to. This is for your own safety and well-being, but also for the safety and well-being of other residents across both states. And can I also stress to New South Wales residents who might have some interaction or family connections to those border communities, to keep everybody safe, please do not go to those border communities at this stage until you absolutely have to. And the reason for that, as I said, is we're trying to ensure that we capture any potential seeding that occurred during the time when those cases were transmitting through Greater Melbourne. Out of those 18,500 tests or so, all but 2 of the previously confirmed cases in Albury are overseas travellers, which is a good result in that there hasn't been any additional community transmission apart from the 2 Albury cases we talked about a few days ago, and I'll ask Dr. Chant obviously to cover that in her report. And there is also a 3rd family member who's likely to have got that, but I'll ask Dr. Chant to give that detailed report. So at this stage there's no evidence of any additional community transmission, but again we all have to be on high alert. If somebody asks me what our status of both sentiment and action should be today and the following few days and weeks, and I say weeks, is we should all be in a state of high alert. We should all be more conscious of the fact that there could be elements of community transmission, especially in those border communities that haven't been picked up, and that's why we need to be extremely careful no matter where we are, especially if anybody has had contact with anybody who's been in Greater Melbourne for the last few weeks. And of course, you know that if you're a returning New South Wales resident, you have to make sure that you self-isolate for that period of 14 days to be safe for yourself, your loved ones and the broader community. Can I also stress in relation to returning travellers, I was asked yesterday about what we're likely to impose. Can I state quite stridently that we will be charging overseas returning visitors before we charge New South Wales residents. So our focus is consideration of what we do with those ongoing return travellers from overseas, and New South Wales has done more than double what any other state has. We've welcomed back about between 30 and 35,000 Aussies going back to their home states, and obviously they've had considerable time to consider their options to this point in time. So the New South Wales Government is considering our position regarding that, and I won't be charging New South Wales residents ahead of charging those overseas returning travellers who've had plenty of time to get back to Australia. I'll now ask Dr. Chant to give her update, and then Minister Dominello is going to recap on the great work Service New South Wales is doing, but also highlight that we appreciate during the course of this pandemic the cost of living pressures on our communities, and it's heartening to know that in the last 3 years alone, $3 billion have been saved by our communities on cost of living measures, and Service New South Wales is continuing to increase information to people who have access to over 70 rebates, because we don't want anyone to feel unnecessary financial stress during this time. And we can, and obviously Service New South Wales is a great way in which to relieve some of that household pressure, and Minister Dominello will talk about that at greater length. But I also wanted to stress that what's occurred in Victoria is a wake-up call for all of us about how contagious the virus is, how it doesn't take very long for things to escalate quickly, and how it doesn't take very long for that rate of community transmission to increase. And so all of us have to be on high alert. That's the state we're on. And because of, as I said, we're monitoring the situation a number of times a day, and because of that high rate of continued testing and the very low rate of community transmission, the New South Wales Government isn't going to make any changes now, but obviously we're monitoring especially the potential seeding that may have occurred in those border communities and also throughout other parts of New South Wales, and that remains our focus. So, Dr. Chan.
So there's been 13 cases of COVID diagnosed in New South Wales in the 24 hours to 8 p.m. last night, bringing the total number of cases to 3,264. 11 of those cases are returned travellers in hotel quarantine. The two other additional cases were the probable cases that we identified in the media on the 3rd and 4th, and they were Albury residents. And whilst it's not included in our numbers today, I want to indicate that there's an additional family member that has tested positive, and that family member has been in isolation for a number of days when we first identified the cases in the initial index case. So just to indicate that the person, the index case did have travel to Greater Melbourne, and we believe that that is the source of infection. I'm very pleased to see the response in Albury. There's been an extensive turnout for testing in the community, and I would continue to ask all the border communities to be vigilant and to ensure that they present for testing whenever they have the mildest symptoms. I would also like to clarify that whilst when the border closure came into effect, there were requirements to self-isolate with some exceptions for critical services. Those self-isolation guidelines need to be adhered to. That is critical. And again, I would urge you to get tested if you've got even the minimum of symptoms. Prior to that border closure order, there were public health orders in place. And in essence, anyone who had returned from the Greater Melbourne area needs to self-isolate for 14 days after departing the Greater Melbourne area. And I do call upon the community to heed this public health measure. It is essential that we stop the further seeding into New South Wales of cases from Victoria. And I know that it is challenging sometimes to self-isolate, but I call upon family members and community members to support people to self-isolate, and also urge anyone who has returned from Victoria, in particular hotspot areas, to come forward for testing with even the most minimal symptoms. This will help us to keep New South Wales residents safe.